Let's go and start recording. This week, we're going to be going over chapters 37, 8, and 9. 39 is that chapter that you really need to go back and review. Those are the variations in nursing, pediatric versus adults, because there are differences. And those differences do make a difference in how you treat a patient. Also, what I have found is I use stuff from adults with pediatrics, and I use some things from pediatrics and adults, and it works. So when you're both ways, adults and children like me, there are tricks that can be used. So let's go ahead. Let's get started. Let's get our Kahoots done. We should be right at 8 o'clock, maybe a couple of minutes too, if we're lucky. 40 questions. Remember, these are those concepts that, if you could take them, apply them in any way, you really understand them. Always go back, do your interactive PowerPoints that are there for you. And, those Kahoots, as I said, are always important. They're always going to share with you something that is going to be seen in your future, whether exams, whether HESI, whether NCLEX, it's going to be there. Everybody join who wants to join. All right, let's get going. Week 4, pediatric variations and whatnot. Early detection of a hearing impairment is critical. Which one is of primary importance? So when you're unable to hear, you're not going to be able to speak the way you should. The pronunciation of words, plus you're not hearing everything. So are you learning as well as you should? So when you talk about hearing, you talk about speech. So if somebody's not talking well, you're going to do a hearing test. If they're not hearing well, you're going to check their speech. So hand in hand, remember that, both of them. A parent recognizes that her toddler has a speech delay compared to the older siblings. What's your priority? What should you tell her? Remember, hand in hand. We do send our newborns home today. They have to have a hearing test, but it doesn't mean that due to many different things are hearing delays. So you're not talking right. Again, it's talking about speech, hearing. So whenever we're talking speech delay, check the hearing first, and then you can go into therapies. We have to make sure it's just because you don't hear well. A multi-select. What are signs of an early indicator of impaired cognition? We've learned all these growth development things and grasping things, motor things, fine motor, gross motor, and we're learning about them. And if we're not where we should be in their age, we have an impaired cognition somehow. So you're not going to see a child who's with impaired cognition. It could be due to nutrition or it could be due to something else, but they're not talking the way they should. They're not saying mama, dad, or anything of the sort, or even trying to pronounce. When you take a rattle and you can't even grasp it by yourself, you should be transferring hands by 7 months. And if you have decreased cognition, you don't understand as well. It's the way you think. So you're going to be having behavior difficulties because they're going to be screaming, yelling, sitting on the floor, and just screaming because they don't know what things should be. And they get frustrated. So you will see behavior difficulties. A child is being treated for a fever. The reason for treating the child's fever is what? I had many parents bring their child into the emergency room in a frantic panic because their child's fever was 104. Having a fever is not a problem. You will not have the chances of having life-threatening or seizures for high fevers when you already have a fever are minimal. The time that you get the febrile seizures is when you have no fever and very quickly your temperature goes up. So in 20, 30 minutes, you go normal to 102. The brain goes synapse and it starts to seize. And that's what happens with a febrile seizure. How do you feel when you have a fever? You ache, you pain, you feel icky. Yeah. You give a kid the medicine, they go from sitting in the corner, not eating, not drinking, to up, running, drinking, playing. And that's what you want to do if they're sick, get the fluids in them. So keep that fever down so you relieve that discomfort and the child feels better. It is not for any other thing. Separation anxiety in a child hospitalized, which behavior indicates a stage of despair? Well, separation anxiety is when you have to separate the child from their caregiver, their mother, their father, whoever. And for whatever reason, we have to separate them, or parents can't be there, have to work. They have to go to the other children or whatever. Now, this is actually the third stage of separation anxiety, where in the beginning they cry, they scream, they yell, they sit there, have a fit, and they continue. And by the end, they're so tired of crying, they're like over it, and they're like, okay, I guess this is what it is. And they start sucking their thumb. They regress, or they take their blankie and they're rubbing it, or their little stuffed animal, whatever. They regress because they realize, you know, they're not coming. Mommy and daddy aren't here. One of the most important things about having a small child in a hospital is have parents staying with them, because that is their security. And it's not always feasible. A child with a history of abuse, which therapy explores emotional problems. Now, remember, children don't know if they're abused. They don't know what is right or wrong, whether it's verbal or mental or physical abuse or sexual abuse. They don't know. So having them with this will tell you what has happened to them, so you can understand it, because they don't know how to verbalize. They don't know it, and you don't want them to realize it. So they play it, you can see what happens, and then we can work with therapy to help them. Play therapy, so important. I told you, play, 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 right? That's why I went to school and went to work in pediatrics all these years, because I went to work to play with my kids. A child is extremely fearful of hospitalization. What type of play explores these fears? When you talk about children and hospitalization and being afraid, these are usually those children, like sickle cell children, who are in and out of the hospital periodically, children with autoimmune issues, and they've had a bad experience maybe along the way. It can happen, right? So it's important to find out what happened to that child that really made them scared. And we do that through dramatic play. If they've had an x-ray, maybe we'll do something that looks like an x-ray, dramatizing that so that they can show you what happened to them. So dramatic play is very important, because we don't want children like with sickle cell every time they come in screaming and be afraid and scared. That's not what we want for our kids. When checking the IV in an infant, you notice the tissue around the IV is swollen. What's the first thing you should do? Priority action. Number one, whenever you doubt with any, from adult to infant, It looks swollen, turn it off. You can always check the site. You can always, flush it if that's what you decide to do later. But number one, turn it off. In helping a child to adapt to a hospitalization experience, the best approach is what? And when you talk about toddlers, you talk about preschoolers, they don't like to be disrupted at all. So if we keep them on that same routine schedule when they eat, hopefully the foods that they eat, nap time, bedtime, bath time, they're going to be a better, happier child. Can you bring toys in? Oh, yes. Can you bring foods in? If the diet allows it, yes. But it's that routine, which is the best thing we can do for a child. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? And then as we're using that Snelling chart, and at that distance they can't see anything, what would you do? I mean, we can move it up a little bit, but we really need to tell the physician that we're seeing very bad, poor eyesight. It's 20 feet. That's what you learned in health assessment. Just another question. Continue it through on into peds. What is a 3-year-old biggest stressor of being hospitalized? 3-year-olds are preschoolers. They adapt to changes a little and stress a little better than toddlers, but still. These children, now, are they afraid of mutilation, strangers, and pain? Yes. But the biggest stressor of a hospital is when mom and dad leaves and they're alone. But all the others, yes, that is part of growth and development. Absolutely. But it's that separation from parents that really, it throws them over the edge of stress. They want mom and dad. A multi-select. What is the best way to alleviate the stress and anxiety of a hospitalized child? So again, same routine, go developmentally appropriate with everything we explain, and allow those parents to stay with the child. We're not doing invasive procedures in the children's room. That is their safe place. We'll usually take them out into procedure rooms, start an IV, whatever, but that room is their safe place. So we do not do procedures there. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention is what? Like, what does that string mean? Does the parent know that string is there? Now, many cultures practice many different things. Cultures put the string there to ward off evil spirits. I was given this little blue thing here. It's called a cat's eye, they said. And it was from a parent of Hispanic parent. And they gave it to me because it was to ward off evil spirits. Now, many children in Miami with the Hispanic culture, they have these little black ones. I'd never seen a blue. It was different. But this, again, is to let people not get their bad feelings towards the child so the child can feel better. It's just one of those cultural practices. So you don't know what something is, again, culturally, ask the child, ask the parent, so they can tell you what it's all about. There's usually a reason for it. How can a hearing impairment develop? It could be present at birth, could be you're missing some, physical parts, could be from illness, ear infections. All of these things can cause it. Yes. Which urine collection method on an infant is the most accurate? Now remember, infants are very tender. They really get sick quickly if we don't treat them well. And we want to get the best culture on that urine so we know the antibiotic has been the correct one, instead of trying to do urine after urine in order to we're just testing what the skin has, whether an uncircumcised male in between the labia on a female can be very full of tissue or bacteria. So when you do a straight catheterization, most parents are like, oh, but it's going to hurt. When you take that pacifier and you have the parents talking to the child and just holding their hands and stroking, have a nurse hold the legs easily, it's in and out. They barely know it's done, and if you do it without them crying and screaming. So a calf urine gives you the accurate information for your culture. One time of antibiotics, we know it works because it's a good culture. It's not culturing the skin. Multi-select. What is the purpose and function of the family? Family-centered care, right? Pediatrics. That means you take care of a child, you're taking care of a family. The family is that safe place. It's that emotional comfort identity. And we know that's where that child begins understanding their cultures, their beliefs, their values. And then, of course, as they get older, they expand out and friends and learn different sort of cultures and families and practices and rituals. But family is really, really important for that child. And number one, it's that safe environment, hopefully, for them. The primary goal in caring for the child with cognitive impairment is to what? Say you have a child who's born with Down syndrome and they're cognitively impaired. They're not going to be doing all the gross and the fine motor things that, a child who was born who didn't have Down syndrome. And the earliest we can start early intervention will promote optimal development. Years ago, we didn't do speech therapy, occupational therapy, physical therapy, and teaching these children how to be more than just putting them in the chair, putting them in the bed, bathing them, changing them, feeding them. That's what was done many years ago. Today, we have found that children with cognitive impairment can be trained to do things. Some, maybe it's just understanding like a circle and an oval and a triangle. And I know that I had a really cute kid, Jonathan, at the daycare with the pediatric specialized daycare that I was doing clinicals at. And little Jonathan, nonverbal, CP, spastic CP, he knew how to do his shapes and he knew his colors. And then they were working on other stuff with him. So they want to expand their minds, not just to physically take care of them. It's part of their education, and they do learn with that repetition. What is an example of a cognitive milestone for a toddler ages 1 to 2? So cognitive, remember, cognitive is all about thinking. So a 1 or 2-year-old should be able to take their shoes and say, take them off, put them by the door, maybe take their laundry to the basket, little things they have been taught how they can do. And this is about how to think and how to take that think and do something with it, a simple direction. Many infants require oxygen. What type is best tolerated and accurate? Excuse me. So an oxy hood is a clear plastic hood that goes over the head, has a little space for the neck. You put a little sensor in there, and we can see how much oxygen is being flowed there. This infant's face is just free. They can suck on their pacifiers, or their hands and their fingers. Now, endotracheal tubes, I've been intubated. It is horrible. Tracheostomies, again, it's a different way, but still not as easy as just breathing around in this little environment. And that nasal cannula, they usually have to tape it. So now they're taking their fingers and they're pulling it and they're ripping tape off. So it's not tolerated as well as that oxy hood. What is the best practice for school-age children with special needs? You have children that are going to school, let's say they're in a wheelchair, or they're visually impaired, or maybe they're nonverbal. I had a girlfriend's daughter, smart, but she couldn't speak, something with a stroke at birth in her voice center. But she right into regular classrooms. And what it does, it promotes them to learn more. They see what a child, quote, normal is, and they strive to be there. It is found to be best for children to be able to be going into regular classrooms. I mean, there's still those special classrooms, but most children should go there. Just because you can't walk, that means you can't go to regular classroom. Your brain is still smart, right? Collecting a heel stick blood specimen on an infant can be made easier to collect by doing what? Now, infants, up to the age of 1, you can draw about 2 mLs of blood out of a heel, and you can do every single lab test you need, except for blood coagulopathies. So there is a great picture in your book where to do it. But if you think about you're trying to make something bleed, you want to dilate the vessels. So only a hospital approved heel warmer, because you can burn an infant's foot very easily, right? So only that hospital approved. And then if you take that foot and hang it down over the side of the bed and squeeze it there, I'm telling you that gravity will put it into the containers a lot quicker, and you don't have to squeeze as hard. So using a warmer, if I know I'm doing labs, immediately I'm putting it right on their foot. Referrals for cognitive impairment should occur when you suspect something's going on, or child's a little bit behind. And yeah, should be started as soon as you suspect it. It's not going to hurt to put a child in these therapies. In fact, sometimes it even advances them. So if you suspect something's going on, getting them into therapies, best thing you can do for your child. A client with mild intellectual disability. Now, there are many children that grow up to be adults, right? And what if they are a mild Downs, which means they can be trainable, means they can work and they can live normal lives, right? Now, the one thing about allowing that, not allowing that, but for it to be done the best way, make sure that they have somebody watching over them. I had a class where one of the students said her uncle's with Down syndrome lives in a place with 2 other people with, disabilities, and they have somebody who watches over him, making sure their finances are good, making sure that nobody's taking advantage of them. Because remember, they don't know right or wrong, and they're more easy to accept what somebody says. So just as long as they're watched, remember, these young children grow up to be adults, and actually you need to make plans for their futures. Down's children have frequent upper respiratory infections, and why? The biggest thing is because if you look at their noses, they're flat on their bridges. Right in here is very flat and the bones aren't made as well. And what happens is a lot of the mucus sits there and it creates an infection, usually staph, and it drops down on the throat, coughing, and all that mucus appears because just their nasal bones. A multi-select. What would be included in the care plan of a patient with moderate cognitive impairment? The prescribed pediatric daycare that, I did clinicals with, they were so good with their children. And the one thing I can tell you, they did the same thing at the same time every day. So these children didn't have to think, they knew what was coming next. So that structured schedule, so important. Now, toys, of course, developmentally appropriate and safe and teach a skill for sure. Now you will see with the autistic children, they don't like bright lights, they don't like big noises, they don't like a lot of people, and sometimes even texture, like in their mouth. They don't like it soft or they don't like it chunky. It's different things, it's those sensations, but they need to be exposed to those things. So we need to do all of those so that we take that child and give them the best that they can be. Another multi-select. Why do children with Down syndrome have frequent respiratory infections? There's some more to ask you. One answer. So, of course, the underdeveloped nasal bone, but they breathe through their mouth and their noses are stuffy, all interrelated to that mucus sitting there. What are some clinical manifestations a nurse may see in a child with Down syndrome? It's all the above. There's that flat face, tiny nose, low set ears, big tongue, almond eyes. You'll even see the semian crease, on their hands and their feet. And sometimes as an infant, that's the first thing you see when you suspect. Another multi-select. Autistic children demonstrate which behaviors? So autistic children tend to not like to be around people. They tend to go in the corner. They tend to not listen. They're not going to, if you call their name, many times they're blocked out in their world. They're not going to respond. Again, own, playing, repetitive behaviors over and over again. Take a truck, put it on a stool, put it on a chair, take something, put it on top, take it off the top and take the truck, put it down and do it 28 times over and over and over again. It's just part of what comforts them. Also, they're not going to be speaking like other children. They might have one or two words, but they do make themselves known. They don't like you to look in the eyes. They don't like it. They don't like to be touched. It's what we call that personal space. These children are the masters of personal space. They don't like that contact. A multi-select. Fragile X. Fragile X is the second most common syndrome. It is similar to Down syndromes, but the one thing with Fragile X, they tend to have more outbursts. They tend to not be able to control their emotions, so they need medications to keep them relaxed. They do, of course, just like Downs, intellectual disabilities, learning disabilities. They have big ears, a big chin, different things that you might see on them. But there's nothing with their diet with either of those syndromes. Causes of autism. You know, the answer really is, oh, boy, do we wish we really knew, right? We don't know if it's genetic, something in the brain. We're really unclear. We do know it's more boys than girls. And we do know that usually we're not going to diagnose it till about the ages of 2 or 3. We might suspect earlier, but they will not diagnose to after those ages. Ways children with hearing impairments communicate with each other. You know, children with hearing impairments, even children with different languages, they don't speak each other's language. They can communicate. But yes, there is sign language, finger spelling, lip reading, all of that also. Children are great. They put them in the same room. It doesn't matter. They all get along and they seem to play. What is amblyopia? Has to do with the eye. So amblyopia is called a lazy eye. That means one of the eyes goes to the side, inwards or outwards. It's lazy. It doesn't want to go straight. How do we treat amblyopia? Well, that muscle is weak. So we need to make that weak eye work. So we cover the good eye and let the weak eye work. And what they do is they'll put a eye patch on the good eye and we'll maybe 2 hours, take it off for an hour, put it back on, off and on, so that we let that eye muscle build up and start tighten up and to work better. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? So again, excellent. Yes, let them play with it. Let them touch it. Let them feel it. Let them take those vital signs on you. Absolutely. What child may be more stressed when hospitalized? It's probably that child, like a sickle cell child who's in and out multiple hospitalizations. They could have had a bad experience. And that bad experience makes them scared, stressed before they go in the hospital again. So they need to do that traumatic play, right? To find out what happened so we can stop that stress from occurring. A toddler has a hard time fixating on a single point. The child's eyes cross the midpoint. The eyes keep crossing. What is it called? and it's called strabismus. You know, the eyes are crooked and they can't focus and get to one point, and that's going to have a hard time with depth perception. So they have to train those eyes again to stop, you know, with the crossing over. Again, it's weak muscles. What can help the parents to make a baby swallow their medicine? You know, you have many children, toddlers, don't want their medicine, pinch their lips, you know, you do everything, hold them down, you hold their nose, all sorts of things. I've seen it all. But if you take a little bit of that medicine, get it to the side of their mouth, take a deep breath and real quick, real fast, they get scared and they swallow the medicine. Now, I used to do it myself, but you know, today with infection control, no, the parents, I teach them how to do it. But put it to the side of the mouth. If you put it in the back, they're going to vomit. Don't add it to food or formula because you don't know if they ate all the medicine unless they take all of the food, all of the medicine. I mean, if it's a little teaspoon, okay, but besides that, not in food and medicine. And pinching the cheeks, they're still going to spit it at you. Treatment for amblyopia involves so treatment for amblyopia is the lazy eye. We want that lazy eye to work. So we cover the good ones, that lazy eye, okay, go to work. You know, it will strengthen the muscles and eventually it will get where it needs to be. Yes. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What is important? Now, what if you have a child that is Downs, maybe, you know, autistic, and they're, you know, a girl and they're an adolescent, they're 15 years old. What do you need to talk about? What needs to be done? And we know that this is the age that these children are abused because they don't know what's right or wrong and how they should be touched. So a well-defined concrete code of sexual conduct. Then that child knows what they can do and what they can't. They're not going to have somebody persuade them to do something they shouldn't, because it happens all the time. A multi-select. A child is asking mom about his sibling in the hospital. How can you alleviate his stress and fear? You know, when COVID happened and brothers and sisters went in the hospital, you know, the children at home, you know, their brothers and sisters were like, what's going on? You know, they don't know what's happening and they're stressed. They want their brother back. I mean, today at least we can get them in there, hopefully, but sometimes if you can't get in there, at least write a letter, make a card, do something for the one in the hospital. And sometimes the kid in the hospital could do it for the brother or sister at home. And I've helped children do that. And then if they're coming in, and let's say they have a tube in their throat, or they have tubes hanging out, or monitor noises, let that sibling who's coming in know what's happening, because they'll get scared. Last question. What types of play allows children to express their fears of hospitalization? And it is called dramatic play. It's like putting on the drama, what happened, and now we can figure out what we need as healthcare professionals to change to make this child not be afraid. See how we did. Number 3. Shauna, good job. Number 2. JD, number 1, the whole game. Brianna, good job. What I'd like you to do, please sign your attestation for your attendance, please, so that we can make sure that you get credit. Again, you can ask me for your grades if you want. Saturday, probably you'll get your final grades. I'll make an announcement for you so that you know that you have them. I'm going to try to get it out Friday evening, but it depends on getting us professors all together. So thank you so much. Great, great, great job on your exams. Everyone passed. So congratulations. Thank you. And I will see you next week. Respiratory cardiac, rough week. Come prepared. Please come prepared.